Ancient medical techniques that weirdly outperform modern ones. Number 3. Bone-setting sorcery. Picture this. You trip over absolutely nothing, because of course you do, and suddenly your ankle folds like a lawn chair. Today you'd go to a clinic, wait 40 minutes, fill out 5 forms, and maybe get an x-ray if the machine isn't temporarily unavailable. But in ancient times, you'd be scooped up by a bone setter who, despite having 0 medical degrees and probably smelling like smoked goat, could snap that joint back into place faster than your brain could say, "Wait, is this FDA approved?" Here's the weird part. A lot of them were really good at it. Not because of magic or rituals or chanting over the moon, though they absolutely did that for flair, but because they learned through generations of trial, error, and, whoops, we won't try that again. Their hands basically became human MRI scanners. They could feel micro shifts in joints the same way you can tell when your phone screen protector is one bubble away from total disaster. Modern medicine uses imaging, stabilizers, and protocols, but ancient bone setters relied on muscle memory and ridiculous accuracy. And sometimes, that hands-on precision beats your local urgent care, which is shocking, slightly upsetting, and honestly makes you want to stand very still forever. Number 2. Honey surgery. Imagine lying on a wooden table while someone with a bronze knife leans over you and says, "Don't worry, this'll only hurt a lot." Then, instead of antibiotics, anesthesia, or literally anything comforting, they smear honey into your wound like you're a human pastry. And the wildest part, your odds of avoiding infection were sometimes better than if you walked into a modern hospital during flu season. Honey wasn't just a sweet treat, it was ancient medicine's overachiever. This sticky gold is naturally antibacterial, creates a seal that blocks germs, and basically acts like a medieval force field against infection. Your body tries to freak out, and the honey's like, "Shh, relax, I got this." It dehydrates bacteria, slows their growth, and keeps your wound environment stable in a way that would make any hospital-grade disinfectant mumble, "Okay, show off." Today we sterilize, sanitize, irradiate, and overcomplicate, but ancient healers just dipped into a jar and slathered you like toast, and somehow it worked alarmingly well. It's ironic that the same substance you panic over when it gets on your fingers was once a life-saving bioshield. Number 1. Moldy bread medicine. You're sitting there with a nasty-looking cut, the kind that makes you rethink every life choice that led you to this moment. In modern times, you'd get antibiotics, assuming you can pronounce the name without summoning a Greek deity. But in ancient Egypt or China, a healer would take a chunk of moldy bread and press it right onto your skin like some cursed sandwich topping. And here's the unnerving twist. This wasn't superstition. It was basically the caveman version of penicillin, before penicillin existed. The mold growing on bread often contained naturally occurring antibiotic compounds. These microbes would go to war with the bacteria in your wound, like a microscopic bar fight happening directly on your body. Meanwhile, you're lying there thinking, "Cool, I'm a science experiment with carbs." The best part is that ancient healers had no idea why it worked. They just knew that when they used clean-looking bread, people stayed infected, and when they used the fuzzy blue-green nightmare loaf, patients got better. Evolution did the homework for them, and humans just took credit. Honestly, it's both brilliant and extremely on brand for our species. That's all for today. Don't forget to like, subscribe, and tell me in the comments how your day's going.